For me personally, I am no digital expert. In fact, I'm absolutely the opposite. And it was quite a lot of amusement went round my family, particularly my teenage son, when I embarked upon this, because he actually couldn't comprehend that I would ever be able to do anything much more than turn the telly on and off. And that's the honest truth. So please, if there's anybody thinking I'm not ready or I'm not digitally up to it, you really don't need to be. That's actually not what it's about. It's actually about looking at a problem that you've encountered. So in my case, I work in general practice. I'm in quite a small practice of 5,000 patients. And my problem was that all of a sudden, when COVID came, the doors more or less shut. So for me, my biggest problem was, one, how I was going to see the patients. What on earth was I going to do, and what was my role actually? And as I've said before, I work for the training hub, and the other parts of my problem was, how was I going to see any student nurses? So a part of my role in a training hub is to hopefully let student nurses see that primary care is a fantastic place to end up once you're qualified. I think it is. But they don't see that, and they weren't going to see that if the doors were shut. So they were my two. That was my problem, and that's what I went to the Topol Fellowship with. That problem. And my journey has been about how I've solved that problem, or what I can do about solving it. And I think, and I'm hoping Stuart won't mind saying this, but my biggest probable barrier to this process was myself. And I think that is typical of all nurses. And I don't know whether Sarah would agree, but nurses, for whatever reason it is, think that we can't do stuff like this. We can't fill up in a decent application form. We can't do digital stuff. We can't do fellowships. Even word fellowship would probably make you think, dear God, there's no way I can do that. We think for whatever reason that we can't work alongside doctors from secondary care, primary care, intelligent people with all sorts of fellowships and masters. And you know what? We can. And in fact, the thing that we've got better than anybody else is that fundamental care about patients. And that is absolutely at the core of everything that we do as nurses. So for me, I would say nurses are perfectly placed to do this course. I would love to see more nurses doing this. I would love to see more nurses from primary care doing it as well. But that's another issue. But nurses, I'll take that, nurses for sure. So I went about my sort of solution that I had half in my head was around seeing patients virtually in a group setting. So seeing a group of asthmatics, for example, seeing a group of diabetics, a group of patients with cancer in a group setting on Microsoft Teams, and seeing them in that way, and improving their health outcomes, and actually doing whatever they wanted me to do as a nurse. They couldn't see me, and they were delighted to be able to see me in this way. And then alongside that, to get student nurses to think that seeing patients face to face isn't always an option. And that pandemic's taught us that, hasn't it? We never would have thought in a million years that we would be seeing patients on Zoom, or Microsoft Teams. We would never have done that. So to get them to think outside of the box in their journey as student nurses and then qualified nurses. So I brought 3 student nurses with me on this Topol journey in their second year from different disciplines of nursing. And I can honestly tell you that if it wasn't for them, I wouldn't have got as far as I have, because I don't know if anybody's ever worked with students. They're the best people to work with, aren't they? Because they just challenge you at every obstacle, and they see things so differently than you do, because quite often, we're entrenched in what we do every day and we can't see the wood for the trees. So they came along with me on this journey, and it's been the best. It's been, I have to say, the making of me. I would never have thought I could speak to you all, even on this platform 12 months ago, 18, would never have dreamt it. I've talked, I've been to Birmingham Best Practice Show. I've talked around the country. I've talked to different nurses, and I've thought that this is definitely something I want to do. Stuart said something about, where you see yourself in the future. And for me, I see myself as inspiring other nurses, hopefully. Even if I inspired other nurses to do this, I'd be happy. Just to give people the confidence to give it a go, think outside the box, sit outside your comfort zone, panic a bit, and then take a deep breath and think, give it a go, you can do it, because you can.
So yes, as you said, I'd like to introduce myself a little bit, but also talk a little bit about the national picture and why it's so important for nurses, midwives, AHPs, anybody who has that inkling of, do you know what, there's a problem we need to sort out. How are we going to do it? How can we do it together? So as I say, I'm Sara Nelson, and I am Deputy Chief Nursing Information Officer. Bit like Maggie said about the fact of her family falling about laughing, there is not a chance my family would have ever thought I was doing this role. What I wanted to do was I wanted to be a ward sister, because ward sisters could change things. And that was what was really important to me. And then as time goes on, I took that opportunity to go through slightly different paths to what I thought I was going to do and take those different opportunities. And it was often the opportunities that were outside of the actual role that made the difference. And they were the ones that gave me the confidence to go on to the next role. So it was doing an extra qualification, or it was doing, and I'm talking minor qualifications here, or it was doing a course, or it was going and speaking to somebody. And they were the things that made the difference between doing my normal role and moving on to these slightly random roles. So it was about 6 years ago now where I had been site manager at one of the big London teaching hospitals. And I was aware that we'd had multiple situations where technology had been great when it was brought in beautifully, but it wasn't good when it caused problems. And the impact that that had on our patients and on our staff was quite immense. And so somebody said to me, Sara, there's a job going within IT for a nurse. Would you be interested? And I went, yes, absolutely, because I'd far rather be in there helping them to understand what our problems are than just sitting here moaning about it. So for me, it was that opportunity to do something different. I didn't know how it was going to go. I didn't know how I was going to feel about it, but I just knew that patients and staff deserved the best technology we could bring in. I realised that data was actually quite important. Having come from an environment where we inputted data, but we hadn't actually done anything with it, we were starting to realise that by seeing some data and realising how we could change our practices, that was actually helpful. This is all about people. And the CNIO is that senior executive or strategic nurse who developed that strategy for the technology enabling our care. It is not about bringing in digital for digital's sake. And there are a small but growing number of digital leaders in our country. There are people of all levels that I've come across in the last sort of year since we've started doing this more. From our band fives who are interested, who are wanting to get involved but not sure where to go, right the way through to our Chief Nursing Information Officers and the Chief Nurses. And we need to make sure that the Chief Nurses understand this as much as everybody else, because they're the ones who are going to give us those opportunities. But we need people in every diverse area of our practice. We need people of all ages, of all ethnicities. We need people who have the right attributes and skills. So we need people who have tenacity, who want to take risks, who want to be brave and be curious, because actually this is quite a hard job. We're at that early stage of changing the whole of our nursing practice or midwifery practice or AHP practice for the rest of our lives. The life that my daughter will come into in nursing is going to be very different to the life I came into in nursing, where we actually didn't have a computer, but that is a different matter. So, as the Chief Nursing Information Officers team, we came together about a year or so ago now to look at how we could bring technology in. But we realised that there's an awful lot of things out there that we didn't actually know. We had no idea how many digital leaders we had out there. We thought we had maybe about 10 CNIOs, and then suddenly we put out our survey, to our digital maturity survey, and found that we had 157 come back with information about what was happening. And some organisations have quite a few leaders, and some have very few. But actually what we did find was that people didn't necessarily know about each other, and they didn't necessarily have, they were very big differences between pay, between responsibilities and things like that. So the things that we're concentrating on within the central team is education. We need to make sure that people are given bite-sized pieces, a little bit bigger pieces to actually, and courses, or those who want to go on and do a master's or something in those areas. But we need to make sure that technology is available for everybody and that nurses are involved at every level. Leadership. We've started now we realise that there's a lot of, often people talk in the NHS about silo working. And actually, one of the things about being a digital leader at this moment is that sometimes it can feel quite lonely. And sometimes it can feel like you really need to have somebody else around. So getting involved with those networks, those peer support groups that Stuart's talked about and things like that make a big difference to how we can get on with our day. You'll notice this lovely building behind me. I've spent this week with some digital nurses who every single one of them, Maggie, what you were saying, that confidence level, we never thought that this was something that we were necessarily going to do. We never thought it was something we were capable. We still have that little person on our shoulder. Some people do actually have great confidence, but actually a lot of us have that little bit of a worry of, goodness me, what am I doing here? So being in an environment and being paired up and peer supported and mentored and coached does make a huge difference. We're also looking at the strategy of nursing and midwifery, and we want your help as those people who are interested. The fact you've come onto this today gives us that opportunity to work with you, and so that we want to link with all of these programs that actually develop you so that you're part of this bigger team that we're dealing with. Innovation is fascinating, but we need to make sure that we bring in the right things and that the people who are bringing them in are supported. We need to look at our practice and we need to look at the research behind what we're doing, because we need data as to why nurses are so fundamental in this, but we also need data as to how can we change our practice to really benefit our patients. So we're at the beginning. We can't do it alone. We need to work in these networks, but we also need to gain our confidence. And we can do that by going to things like this and spending a whole year developing yourself, to have that time to think that you would get through a program like Topol. So I would like to say, please, 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 this is really important for us as a profession. Ruth May says she wants nurses to have a voice and to be at that table, and that's our responsibility to do so. So when it's the right time for you, please go for it and put that application form in. You never know what's going to happen.